We're here now with Lori Schley, the Director of Nursing at the Specialty Fusion Center in Marquette. So thanks for joining this conversation. Let's start with a bit about your background and where you came from, the expertise that you bring here to the Specialty Fusion Center.
So as Jody mentioned, I am an oncology nurse by background. I worked hospital outpatient oncology for about 15 years. I was manager of an infusion center at a hospital in the lower Michigan, and just loved it and remained an infusion nurse since then.
What have you loved about being an infusion nurse?
There's a lot of time to get to know your patient. It's very personal patient care. It's not, you're not a number when you come in. We know your name, you know ours, we know all about you, your family, your background. If we don't have information that comes to us from the provider about your background, we do an in-depth assessment on every patient regardless of the information that we get. As we all know, some of those notes that we get from providers can be a little incorrect or missing parts and pieces because we're coming from specialty physicians versus primary care, who sometimes will encompass everything that the patient has had happen throughout the years.
So what are some of the conditions, ailments that people would come here for?
We see patients with myasthenia gravis, multiple sclerosis, Crohn's, ulcerative colitis. We are starting to see some oncology therapies trickle in terms of the monoclonal antibody therapies, the maintenance therapies that patients stay on after they're done with their cytotoxic chemotherapy.
So you don't do chemo here, but then they would do something afterwards.
They oftentimes will have chemotherapy in the hospital outpatient setting, and then we follow with maintenance therapy, or it's called mono or polytherapy with monoclonal antibodies that help target. They're more targeted therapies, not considered toxic.
And so people may come here once, or do they come here for, she was saying sometimes they might come once every 6 months. Or so what does a routine here look like, or treatment look like?
It all depends on their condition, how they respond to therapy. Most therapies, if we're looking at Crohn's or ulcerative colitis, so your gastrointestinals, they'll start out with loading doses at 0, 2, and 6 weeks. And then once they complete those, it goes to every 8 weeks. Now, we monitor them and get back with the physician if they're having breakthrough symptoms during that period, so they can then increase the frequency of infusion time so that maybe we can get better efficacy from the drugs.
Sure.
What are some of the benefits of infusion therapy as opposed to seeking some other type of medical help for some of these same ailments?
For infusion therapy, it's timed, and if you don't come to your appointment, we're calling you to ask you why. So there's a lot of
You kind of have some push from like your medical providers a little bit.
We don't have non-compliance in that regard. So if you're at home and you're taking a pill, you might forget to take your pill. Here we're calling you, telling you, okay, you missed your appointment. You need to come in for your appointment. And then we can question them at that time. Are you sick? Do you have breakthrough symptoms? What's happening? Are you in the hospital? With pills, they might see their doctor, every month or every 2 months, and then they'll say, how many times did you miss taking that? Well, I missed it 6 times. Well, maybe that's why you're having breakthrough symptoms. Whereas if we're giving it to you in the IV, you can't miss it. It's going in your bloodstream, and therefore you're getting most benefit out of it.
And Jody mentioned earlier that this center will take insurance, whereas some hospitals won't for some of these treatments. So I mean, even that is just a benefit on its own.
It is, and insurance-driven medical is where we're all at. We know that in this country. So patients are determined to have better cost. It's cost prohibitive to treat in hospital outpatient for some of these therapies, just because of the additional hospital costs that go along with having a patient in that setting. Here we do not have facility fees and that type of thing that patients run into. We also sign all of our patients up with copay assistance if they're eligible. So they may have a $5 copay on their drug cost versus an exorbitant fee from another facility.
And I know you oversee all three of the specialty infusion centers. What do you hear from patients that come in? What has been some of the response so far?
They love it. It's very comforting. They get to know their nurse. It's like they don't they don't want to come in the beginning, and then before they're done with their loading doses, they're typically, I really like this. I'm not a number. I can walk in. You're taking care of me. I'm not sitting in a waiting room. And all of that type of thing.
Yeah.
We make it as comfortable as we possibly can for them.
Yeah. Well, we are going to take another break, and when we come back, we're going to meet some of the nurses that you would see and meet when you come here to this facility. We will check in with them when we come back.